Welcome back to Mnemonics. Today, I'll be looking at a very important topic, femoral sheath and femoral canal. My goal today is to just tell you simple mnemonics that will help you remember this topic when you're asked to write on it or when you're given a multiple choice question to answer this topic. So we'll start by looking at this essay question, which is write a short note on femoral sheath. Before I dive into the video, I want to tell you that there's a mnemonic that I created that can help you know how to write short notes on spaces, on triangle, on cavity, on tracks. This mnemonic can just give you an idea on what to do when you're asked to write short notes. So we started with the formula sheet, and this mnemonic is A, B, C. Now A means all I need to do, B means boundaries, C means content and clinical correlation. Now with this, you can write essays on tracks, on spaces, on cavities, and so on. So we started with this. Now for A, all you need to know would be just the definition and the location, and it's enough. All you need to know could be just the important, and it's enough. So, but one of the rule of thumb in writing essays in anatomy is that the essay must start with introduction. So all you need to know is introduction, definition, possibly the location. If it has measurement, you can also write it measurements as part of your A. Then B, you go into writing the boundaries of this structure. C, talk about the contents and the clinical correlation. Then you might end your essay with a essay. You must end your essay with an conclusion or summary. So for femoral sheath, all you need to know about it is that it is a funnel shaped fascial enclosing the femoral vessel. So it covers the femoral vessel up to 3.75 cm. It is a funnel shape. Okay, I've tried to represent this funnel shape in this diagram. So with this, you can know that the base of the sheath is directed upwards to the abdominal cavity and the apex merges with the tunica adventitia of the femoral vessel. So this is a diagram. So anytime you're asked to write an essay on anything in anatomy, remember to sketch the diagram. There's always mark for that. You can get 3 points for just sketching the diagram. So for boundaries, we have the anterior wall of the femoral sheath is formed by the downward prolongation of the fascia transversalis, while the posterior wall is formed by the downward prolongation of the fascia iliaca. Now, a mnemonic here can help you remember which fascia form the posterior or the anterior wall. Remember, the aim here is to remember those things. You have a lot to read in anatomy, so we're giving you mnemonics that will help you remember those high things you need to know. So for the mnemonic, you have funnel pit, P for posterior, I for iliaca, T for transversalis. This means that the iliaca fascia is what forms the posterior boundary, while the transversalis fascia will form the anterior boundary. Funnel means it is a funnel shape sheet. Now for compartment or content, this fascia is divided into 3 compartments by an anteroposterior fibrous septa. So it has the lateral compartment that lodges the femoral artery and the genital branch of genitofemoral nerve. It has the middle compartment that lodges the femoral vein, and it has the middle compartment that is relatively empty, and it is called the femoral canal. It contains lymph node of clovets and a fibrofatty tissue. Now here's a mnemonic that can help you remember what is seen in the femoral sheath. But this mnemonic here is ideally meant to be used for femoral triangle, which is the navy. But I'm using it for femoral sheath because the only difference between the femoral triangle and the femoral sheath is the end. A femoral sheath don't have femoral nerve, but it has a nerve, which is the branch, that's the genital branch of the genital branch of femoral and genitofemoral nerve, but it doesn't have femoral nerve. So other things can be seen apart from the femoral nerve. So with the Navy, we know that the artery, the femoral artery is there, the femoral vein is there. There's an empty space which is the femoral canal, and there's a lymphatic which is seen in the femoral canal. So this is a diagram, this is a diagram of the lateral view of the femoral sheath. And this, so as I said, remember to always sketch a diagram view of anything given to you in anatomy. It fetches you 3 points. Now for clinical correlation, A for I need to know, B for boundary, C for content and clinical correlation. For clinical correlation, they might not really bother you with much of the clinical correlation since you are still in clinical class, but you just need to know one or two of the clinical correlation. And the most important clinical correlation here is that the empty space in the femoral canal, which is part of the femoral sheath, the intestinal nerve can hyalinate into it, forming femoral hyalinate. In conclusion, the femoral sheath is a crucial anatomical structure in the upper thigh, providing a protective fascia covering for femoral artery, femoral vein, and femoral canal, which houses lymphatic and allows for femoral hyaline accommodation. Now, how do you summarize even without knowing what to write? You cannot summarize if you know the importance of an organ in anatomy. That can form the summary of that essay. If you write an organ or anything, right? If you don't know the importance, one or two importance of that thing, you can just use that as a summary. The way I used to see, in conclusion, the femoral sheath is crucial anatomical structure in the upper thigh. This is the location, providing a protective fascia. This is the function. It protects the femoral artery and femoral vein. And it just houses the lymphatic. This is the function. Then you allow find it by saying and it allow femoral hernia accommodation. This is one of the clinical correlation. But with just the location and the function, you can give a good summary that will fetch you 3 points in your exam. Now we are going back to the mnemonic again. All A, B, C, all I need to know, boundaries, content, and clinical correlation because we'll be using it for the next topic, which is femoral canal. And femoral canal is a short tube which diminishes rapidly in width from above downward, and it is closed inferiorly by the fusion of it to wall. Femoral canal, as we all know, is the middle part of the femoral sheath. Now, the boundary of femoral canal, the anteriorly it is bounded by inguinal ligaments, medially it is bounded by the sharp edge of lacunar ligaments, posteriorly it is bounded by pecten pubis, laterally it is bounded by femoral vein. So we all know that the femoral vein is lateral to the femoral canal, even from the femoral sheath. So, and here's a mnemonic that can help you remember these boundaries. Imagine people love vein. Imagine people love vein. I for inguinal ligaments, P for pectinate ligaments, L for lacunar ligament, V for vein, femoral vein. So inguinal ligament forms the anterior border, P pectinate ligament forms the posterior border, P for pectinate ligament for posterior border. Lacunar ligament form the medial border and vein from the lateral border. So for content, it have the clovert notes, and which is found in the femoral canal. So that's one of the contents, and it can also provide a dead space for expansion of the femoral vein during increased venous return. If this dead space is not present during increased venous return, then it might now start impinging on the femoral artery, causing occlusion of the femoral artery. But this femoral canal form a dead space that helps the femoral vein to increase or enlarge when there is increase of venous return. So for clinical correlation, remember the femoral canal is just a dead space. It can be an inhalation of the intestinal nerve causing femoral hernia. This is an important clinical correlation. Now, remember, for this, you must end your, you must likely, in any anatomy question given to you, it's always important to have a sketch, a diagram that will help you. It's 50 mark, always sketch something Now this is the femoral herniation found in both female and male. I hope that this mnemonic have helped you. ABC for canals, cavity tract. Please, if you love this video and you want to see more of this content, like, share, subscribe, and click on the notification bell to get informed when I release such interesting and high concepts. So please keep pushing, keep learning, don't give up, and at the end of everything, you will get what you want. Thank you for watching.